So this is the Vaccinations a Condition of Deployment 2, or VCOD2, as it is currently known. I'm Louise Bestwick. For those who don't know me, I'm the Chief Executive of Bradford Care Association, and we have been through the pain of this with care homes, and now this has been expanded to wider health and social care. So today we just really wanted to introduce you to what we are aware of, because unfortunately we still do not have full guidance and full information about this, but we certainly can share what we are aware of, what worked really well, and how we managed to actually get through this successfully. It was a challenge for care homes, but actually in the end, we successfully managed to get through it with very little fallout. So how have we actually done that, and how can we support you with that as well? And then just really answer any questions and to go through all the different options out there to support you and your staff in becoming fully vaccinated, and what actually fully vaccinated means, because that is likely to change, and who is and isn't in scope for this, because again, that is potentially likely. We don't have full details, but we can only assume. So we've got a couple of other colleagues joining us on the call today just to help answer any questions that you've got. We've got Tracy Gaston from the CCG, all things pharmacy and medicines optimisation. We've got Gavin Miller from Airedale Hospital, who supports with the exemption pathway, and then we've got Caroline Tomes from public health as well. So they're able to answer all the questions that you've got, and technical or otherwise, and sort of go through some of the myths, etc., we have around vaccine hesitancy. So just to make a start then, the VCOD2 has been debated in Parliament prior to Christmas. We are expecting that either today or tomorrow that will go through its final legislative sign-off, but we haven't had that confirmed. But that's in order to allow a 12-week grace period prior to the 1st of April, which is when we believe this will come into effect. Full guidance hasn't been produced. There is sort of an outline information available, but we don't have full details of the actual guidance available for providers and exactly who isn't and isn't in scope. From what we understand, it's all CQC regulated services, and particularly those who are likely to have any form of face-to-face interaction with a person in terms of the patient, resident, or whatever the terminology client is that you use. So that's it's patient and person in receipt of services ultimately. So, but we are waiting for details of that. It may also apply in certain circumstances to other professionals entering that setting. Yeah. So we're thinking potentially of extra care settings, supported living. We are not sure which route they will go down, whether they'll be akin to, for instance, a care home or a hospital, where all professionals visiting that home will have to show evidence that they are fully vaccinated, or whether it will be similar to those in the community services where it be deemed as their own home and they don't need to do that. So we are waiting for information of that. So working back in terms of a time frame, from 12 weeks from today, obviously takes to the 1st of April for full implementation. To allow the 8-week gap between the vaccinations, so first and second vaccine, to allow the 8-week gap, we are assuming that all vaccinations, the first vaccination must have taken place by the 3rd of February, in order for them to have had their last vaccination prior to the 1st of April, the second vaccination. As it stands at the moment, and I'm sure will not change immediately, certain for people who are within scope of this, full vaccination status is for 2 vaccines. It doesn't include the booster, but there are indications that is likely to change in the next few weeks, and may include the booster. But I would imagine that, again, there'll be some form of grace period to allow for that to be implemented as well. If I can just ask you all to go on mute, if you're not currently on mute, it would be brilliant. Thank you. So we're working towards a very short time frame, literally the next 4 weeks, in which to get any staff who aren't fully vaccinated vaccinated. Now, we are starting, from what we can see in the capacity tracker, with a higher baseline than where we did with care homes, which is really good news. And I'm sure Ben will be able to give us an update of actually where we are in those statistics. And hopefully you've all been able to have those supportive conversations with your staff, enable them to get the vaccinations. And the current sort of Omicron situation may have encouraged more people to do so as well, but we do understand there's a lot of people that are quite concerned about how actually they get the vaccination, whether they need that, etc. So what they will all need to do once they have had that vaccination is obviously provide proof to you that have had the vaccination, and that will be through a COVID pass, which is an NHS app that can be downloaded. And all staff will be able to do that, as they have done for care homes, and you will then be able to register that and then store that information for CQC to evidence the fact that all your staff are fully vaccinated. So, like I said, there's a number of different things we'll need to work through, but what I just wanted to sort of talk through to you really about sort of some of the hesitancy while we have got the colleagues on here, and why potentially some of the staff aren't vaccinated at this moment in time, and answer any questions in the first instance that you've got. Ben, do you want to give us an update as to where we're actually at in terms of vaccination levels in the community?
Yeah, of course, not a problem. So in terms of home care on the capacity tracker, which includes extra care, as of today, as I did the reports today, we're at 81 and 75%. So that's 81% for the first dose and then 75% for fully vaccinated. We're also at 25% for the booster as well. So that's not actually a bad uptake, considering, again, it's not currently mandatory. So it's a really good starting point, especially as Louise said, it's much higher than what we were for care homes when we started and were in this position last year. In terms of supported living, it's not too dissimilar. So we've got 85% on their first, we've got 76% on their second, or as would currently be counted as fully vaccinated, but we are at only 17% for the booster. But I do know from monitoring this on a weekly basis that supported living have had quite a spike recently in terms of vaccinations, so that's probably why there are not as many boosted as there is in home care and extra care.
Yeah, brilliant. Thanks, Ben. And just to say that one thing that we certainly found within care homes that work successfully is where it is about those supportive conversations. It is about just making them aware of how they can access it, how easy they can access it, and you supporting them to do so. And where, for instance, providers and managers have actually booked clinics for people to attend, the appointments for them to attend, and potentially supported them to go down there. We've even been down and held hands while they're having their vaccination because they've been concerned. And that is sort of been the most successful, is actually where you take charge with their consent, obviously, and managing that on their behalf and supporting them through the process. However, we do know that probably that remaining 20% and sort of 25% who've certainly not had their first vaccine, the second vaccine as well, they are probably hesitant, or there might be a number of reasons, or they may believe they're exempt. Now, with care homes, there is still currently a self-exemption available up until the 1st of April if they submitted that prior to Christmas Eve. But that will expire, and I don't believe there'll be any form of self-exemption available within this sector, because there is now a formal exemption pathway, which is via 119, and you go through the various questions there. They send a form out to the individual, they complete that, and then that is sent back and assessed by a clinician, and then a decision is made of whether someone is exempt or not. The difference that we have in Bradford is we were really lucky to be able to set up the Airedale pathway for exemptions. So what we're able to do is, via the Airedale Hospital, is to route anybody who believes they're exempt or are very concerned about having the vaccine for a medical reason through to Airedale, and they can have a one-to-one sort of conversation to discuss what their hesitancies might be, what concerns they have, and how they can be supported to have the vaccine. Or obviously, if they are exempt, then they can be supported through that process with the clinical support. So Gavin, I don't know if you want to come in and just share a little bit about how that's worked so far.
Yeah, no, thanks for that, Louise. Yeah, so we found that the pathway that we had for the care homes was really, really helpful. We had lots of people coming through to us asking all range of questions and various myths that were out there. So one of the main concerns that we've got were people were worried about being vaccinated by airline staff, so staff that their perception was that they hadn't been trained as healthcare workers. So what we managed to do for them was we had to direct them to various clinics around the patch, one of which is Airedale, because we've only got healthcare workers purely working with our system. So that was one of the things. So we got some really good information as to why people weren't necessarily coming forward, which we've then addressed through some of the comms. With regards to medical exemptions, we now have really clear guidance that's been issued to all trusts back in October. When we're doing it through the care workers pathway initially, it was very much based on our clinical judgment at the time, and the advice we end up getting, I think, end up being a day before the final deadline. But we've got really clear guidance for NHS trusts, which basically says that if you're receiving end-of-life care, then you're exempt. Depending on if you've got some severe learning disabilities or autistic nature, then potentially you may be exempt. Apart from that, there are no real other medical exemptions. There are temporary exemption if you're pregnancy, and if you've had one vaccine and you've had a severe reaction to that. But apart from that, there's no other real medical exemptions that are available. So I just want to make that clear so people don't go away going, oh, I've got a minor allergy to something. That's not the case. There are pathways there. If people have got allergies, we can refer through either coming to speak to someone at Airedale, we'll refer you through to the immunologists at Leeds. So there are pathways for that, but there's not really many medical exemptions that are available. I appreciate that if you're looking at the news and seeing what Novak Djokovic is going on there, and that'd be really interesting to see. But with regards to the UK, we have got some real clear guidance on that. Happy to answer any questions or any further information on that. Thanks, Louise.
Thanks, Gavin. So I probably, in the first instance, please use the chat function or hands up, or, you know, just let me know if you've got any questions or what some of those hesitancies might be. That would be really helpful. You know, this is an opportunity. If you've got any staff, what those hesitancies are, why they haven't had the vaccination up to press, and if there's anything that we can do, then we can start answering those. Karen, did you want to come in?
Just to say, I think I believe that one of the hesitancies is around fertility and people who are going through IVF.
Yep. Tracy, did you want to come in there?
So I think that there's been, I mean, this is not a new debate. This is the debate that we had quite a lot with a lot of the care home staff, and I did quite a lot of Q&As about fertility. I mean, there's no reason to think it has any effect on fertility. And the advice we're giving now is that if you're pregnant, you need to be vaccinated. So therefore, in actual fact, if you're undergoing IVF, the best reason to be vaccinated is to protect the baby, because the most likely, the significant number of people we've had in with preterm births and babies' deaths have been those that have been pregnant. So there's no evidence it affects fertility. There was a lot of debate at the beginning about that, and one of the questions that we got back was why is that for pregnant people then exempt? We think that's more to do with legislative law about pregnancy, and that you can't lose your job when you're pregnant. So we think that that's not been changed rather than the vaccination part of it. I think that's what we thought at the time, Louise, because that obviously is an exemption as to why you don't need to be vaccinated, but that's all to do with legislation about pregnancy and not being allowed to lose your job because you're pregnant. Therefore, you can't make somebody have something that they don't want to do. So that's a slightly converse way. I mean, I think discussions about fertility and talking to those patients, I mean, pregnancy is the one area that we are not pushing vaccinations, but we're trying to have one-to-one conversations with all people who are either thinking about becoming pregnant or are pregnant to try and encourage them to be vaccinated, because we've had we've had a number of deaths at Bradford of both babies and mums, and that's nationally as well. So there's no reason to think a vaccine has any effect on fertility. One of the reasons that was cited was that people sometimes bleed, but that's because you get a response, and those are also in the womb as well, so you could get that, and that's why some of the menstrual cycle issues had occurred. Some of the discussions in fertility were very, very early on, and currently there is no evidence to suggest it has any effect on fertility at all. And the best thing they can do is to be vaccinated early, so that they are vaccinated when they become pregnant, to protect themselves and the baby.
Yeah, thanks Tracy. I think the other one probably you could help with as well, which I know we've had discussions about, is a lot, and we do hear a lot about how quickly the vaccine has been developed and obviously come to market effectively. So therefore it's all been rushed and it's experimental.
So I think that might have been probably held more hope, sway 12 months ago, but now we've given 7.5 billion doses across the world. It's probably been the most widely given drug ever in the world so far. So I think that some of those debates, but I mean, the reason it came to market so quickly was, one, the amount of money invested in it was by far and away more than any investment in any drug before. And one of the things about clinical trials is you're normally looking for a patient population that is quite small. Obviously, because COVID was rife, we had a lot of people we could give it to as well. So it went through all the right checks that any drug would go through, and therefore it came to market quicker, mostly because there was more money and there was more people deployed in doing that. But there was none of the checks were rushed through. They've now all got a license. They didn't all have a license originally. They all got an exemption license, which is not quite the same, but now the drugs have, because they've been so widely given. As I say, it's about 7.5 billion doses that have been given now, which is probably, I suspect, Gavin, that's the most widely given drug in the world. I can't imagine anything else has ever been given to 7.5 billion times.
I think actually it's more than that. I'm understanding.
Yeah, I think it is, but I don't know how many. It's over 8 probably by now, but it was 7.5 billion a few weeks ago. We've given over, I suppose, in context, there's over 1 million doses been given in Bradford district and Craven alone, which is quite. That's probably easier for people to understand, that we've actually given over 1 million doses, and we hit 1 million the week before Christmas.
So just coming back on those points, I just looked, 9.33 billion doses have now been given. So I think I very much go along Tracy's view. It's probably one of the drugs that we've given the most. Just picking up on a couple of those bits, talking about the expediency of developing the vaccine. I don't know if you can cast your mind back to, I think it was around about 2007, 2008, there was a SARS outbreak. I remember working in a critical care unit in central London at the time. We had a SARS patient at the time. And it was following that SARS outbreak, which is when the drugs companies started doing the research into the coronavirus, which is very much where the COVID vaccines come from. So actually, the building works of this wasn't just done starting in 2000 when we first heard about COVID. The work for this actually started being developed back in the 07, 08, 09. I can't remember the exact year, all those years merge into one. So actually, this work has been ongoing and has been going through a period of time. And as Tracy said, what often takes the time of clinical trials is all the bureaucracy between phase 1, phase 2, phase 3. And obviously, as the entire world and the country is focused on this, they could cut through the red tape much quicker than they would do, as opposed to it being on the bottom of someone's to-do list and actually getting to the top of it at some point to then progress it through the different trials. And as Tracy said, it's gone through every single trial, and plus on top of that, we now got over 9 billion doses worth of data. Picking back up on the fertility points, if the Royal College of Obstetricians and Gynecologists have got some really good information sources. If you just Google RCOG, Royal College of Obstetricians and Gynecologists, and COVID vaccine, they have got pages of information on there talking about fertility, and that there's no plausible mechanism by which the COVID vaccines can cause fertility. There is some information on there. If somebody is going through IVF at this moment in time, they do talk about kind of the timings of IVF with regards to actually having the dose, and that is also the case with some other doses of immunocompromised medication that some people take. So that's more to do with the timing as opposed to not having it. And as Tracy says, we've unfortunately seen some really sad things with people who have been pregnant. And if we think of, say, a particular medical treatment called ECMO, which is where people, so you've got critical care beds, which is kind of where most people think of the sickest people. Well, if you're too sick for critical care and you go onto what's called an ECMO machine, this is a machine which helps to transfer blood directly into a person, oxygen across in a person, which there's only a few of those in the country. So if you're really sick of critical care, you go to have ECMO. If you look at pre-COVID, the number of pregnancy patients on ECMO was 20%. we're actually, the number of patients who are pregnant on ECMO at the moment is 80%. So a large number of pregnant people are having to go through this treatment, which is unfortunately very, very sad. And we highly recommend that people do get vaccinated, ideally before pregnancy, but during pregnancy, to help protect, particularly in that last trimester, which is where we're seeing a number of poor outcomes through people who are pregnant.
Kevin, can I just ask then, is it best to come through the Airedale route if a member of staff is concerned about IVF and timings, or is it best to go directly through their own consultant?
So they could do either way. I think that because they'll be having regular consultant appointments, it'd be probably best to get their advice as to the timings of it. There is some information on there. If there's someone there, if they can't get access to the consultant, we can always contact one of our obstetricians either at Airedale or at Bradford to get that advice on this per patient basis. The number of patients won't be huge, but we'll be able to find that information, and it does talk about the timings in there. It's just because of the they just wanted to split the kind of the egg implants with that, so they might just say wait 2 weeks, for example, might be there. I'm guesstimating here, but yeah, either through the consultant or come through to us, and we can provide that advice or look into it in a bit more detail on that.
Brilliant, thank you. No, that's really helpful. And just to say, we will make this recording available to everybody, so you can actually then replay this back to your staff. We'll try and maybe clip some of these as well and put them into sort of a YouTube type video that the COVID team produced, just to sort of answer and support you with showing these to your staff, so they can actually hear directly from the experts as well. Just another couple of comments. Obviously, you've mentioned that sort of these figures and things are really useful to be able to give these facts, I guess, back, isn't it, to your staff when they maybe are concerned or challenging around that. So we'll try and get some of these up-to-date facts and keep them available in terms of the number of doses given, particularly within the district and wider, etc. So we'll try and get those types of facts and figures, because I know that will help some people potentially as well. There's also another question about a number of staff had a reaction to the first vaccine and therefore don't want to have the second. I mean, I think it depends what that reaction is, if they felt unwell or if it was something more severe. But I don't know if either of you two want to sort of elaborate on that, about how we can support through that process.
I think it depends what they're talking about, what reaction it is. So if it's like they felt unwell or they've got a few of the symptoms, then there's little we can discuss why. But a lot of people will have had some symptoms. If it's an allergic type reaction, then Gavin is quite right that either the trust or the GP can actually get some advice as to what should happen about getting further vaccinations. But I think it's really difficult when you say you've had a reaction, because in actual fact, that's what we want. We want a reaction. The reaction's good news in some cases. If you're feeling unwell for 24 hours, that shows us that your body has had an immune response. So I suppose it's about spinning that. And I know people have felt unwell, but that's much better than other outcomes that could have occurred. So I think that's really difficult to actually just say, if you have a reaction, what do you do? I think you probably need to speak to somebody. And so if they've got any specific concerns, because a reaction is just such a broad term. But Airedale are going through, and Gavin would be able to explain more about this, but if they've had an allergic type reaction, which is a different thing, and that they are concerned that would get worse or would necessitate things, then we could refer them via the immunology report to determine whether they should get a different dose, a different vaccine, or what should happen. I mean, I think that what we've found is that we've had lots of discussions over 12 months. We've seen a lot of people with different reactions, and we've got a clinical reference group set up within the district that can discuss that on a weekly basis to determine if what we all think would be the right thing to do. But it's also talking to the patients as well, and making them, or the staff, to understand what their concerns are and what reaction has occurred. Because it's really difficult if somebody says they've had a reaction, because probably 100% of people have some sort of reaction. Does that mean you had a sore arm? I don't know anybody who didn't have a sore arm, and people's perception of a reaction and what they're going to feel like is sometimes, oh, well, I don't want to feel that bad again. Well, yes, but is that better than being in intensive care? I think the answer would probably be yes. But, you know, so it's really difficult to answer that per se, I think.
Yeah, I think that we are really fortunate to have this sort of Airedale pathway and this route, because most other areas don't have this and aren't able to have these conversations. But actually, what you might find with a lot of staff, for many of the reasons that they give, and we have seen this, that it is, oh, it's because of fertility, or, oh, it's because I've had a reaction. And actually, they're just saying that because they don't necessarily want to have the vaccination at this stage. Where obviously now it is becoming mandatory, and actually what you're able to do is to say, well, that's fine, I understand what you're saying. You're able to listen and hear and go, yeah, I understand you're concerned about that. Let me direct you here where they can have a conversation with you and they can fully understand that and make sure that you are safe and everything's well for you to have that vaccine. Now, if they're truly concerned, they will have that conversation, or actually if they're not truly concerned, then that was just a reason as to why they didn't, you know, they were using as to why they didn't want to have the vaccine. Then they will just go off. They will realise that there is no other option and that they will need to have the vaccine if they want to continue to work in this sector. So it works from both points. But you as a manager are able to sit there and listen to them and go, I take on board your concerns and here's how I'm going to help address those for you. And it also, you know, it is very difficult sometimes to answer some of the many questions or to rebut some of the many conspiracy theories that are out there when you're not the expert on all things vaccines. But actually through this route, we're able to put them directly in touch with experts who can discuss all that information and have that conversation with them. So it just helps you to act as more supportive role through this whole process as well. Another thing that I think is quite common again as well, and I know this sort of possibly did change, so people who have had their first dose quite early in 2021 and have never actually had their second dose, and at one stage I think we did say that you'd have to then start the course again and different things, but you know, it's just a bit of clarity to say, you know, you can have your second dose at any time. Is that right?
Yeah. That's correct. I was going to come back on the other point, but yeah, so if you've had one dose, you would never start the course again. You'd have the second dose even if it was 2 years apart or a year apart, whatever it is at this moment in time. That's the current advice. Just picking up on the reactions, so the vast majority of people that we see do have minor reactions. There have been a small handful of people that have had more severe reactions, and some of these people we would then have a conversation about, and actually there are people that would say we'd recommend not to have a second dose. But these are small and far between. Like any medicine, there are always risks of side effects, and a lot of them are manageable. And there are a couple of people, as I said, that have had more of the severe reactions. But balancing that up against also the risk of COVID and kind of long COVID. There's other long-term conditions that can be affected with COVID, as well as the short-term effects as well. So yes, we are saying that the vast majority of people COVID is safe, but there is obviously that minor risk. We will talk that through with anyone who are concerned. But the other thing also to bear in mind is when we've given a drug to over 8 billion people across the world, 52 million people in this country have had at least one dose. There is also coincidence that sometimes comes into this. So you'll hear people who've had a COVID vaccine and then a week later have tripped up down the curb and fallen over, and that's then being blamed on the COVID vaccine. Well, them tripping up over the curve is probably unlikely to have been due to the COVID vaccine. And then there's also other things where you hear people have had, oh, I had a heart attack, I've had this or that. Actually, a number of people would have had heart attacks, they would have had strokes, they would have had that, whether they've had the vaccine or not. Sometimes, and whether that is linked to the vaccine, we'll never really know, because is it the vaccine or not the vaccine, or just the person was going to have a heart attack and have a stroke. So these coincidences will happen, because when you give a medicine to virtually every single person in the country, the risk of coincidences do go up. So we are aware that certain people are worried about things, or if they've had a reaction. As I said, the details of that is the key. But if it's something that's severe, we've had one person who ended up with what's called Guillain-Barré syndrome. But Guillain-Barré syndrome also can be caused by the flu. It can be caused by having COVID. And actually, there's people like that. We say actually having a second dose It's up to you. We wouldn't necessarily recommend it, and actually this person did end up having it because they wanted to be protected. So I don't want you all to leave here saying it's all rosy and there's no risks. There are some minimal risks, but most of these risks are really low, and the numbers are something like 1 in a million or so. So I just wanted to make sure we got a balanced argument and don't go away going, oh, everything we say here is it's all kind of fine and dandy, and that there are obviously minor risks, but what we're seeing it is really, really low risk, and there's the risks of coincidence as well.
Right, thank you, Gavin. Are there any other questions at all? And just to say, in the chat, but also it is on the provider zone, and we will be sending, Ben is working on sort of a whole presentation with all the resources and information that you will need, that will go out to all providers, that will, you know, link you directly to this and etc. So that'll give you all the information of how to contact, who to contact, and what the processes are. We are just waiting for a little bit more guidance from the government as to actually who's in scope and who's out of scope, etc. on that. The other thing, a couple of things just to point out is we know that currently with the level of infection rates, there'll be a number of people testing positive, and that they will then have to wait, it's 28 days, isn't it, until they can have their vaccination. So and obviously I can bring Gavin and Tracy in around to discuss why that is. I am presuming there will be some kind of exemption brought in, a temporary exemption for those that can't be fully vaccinated because of a delay due to COVID as a status as well. So, but we haven't had confirmation of that yet, just to make you aware. I don't know if you want to answer on that, Gavin.
Yeah, so there is so for adults, so anyone over the age of 18, there is a 28-day gap. I appreciate that probably you don't have many children or people under the age of 18 working, but that is a 12-week gap. So if any of you or your colleagues, no children, it is a 12-week gap. That is causing some issues because that's not on the government website, so I have emailed them to ask them to add that. So it's a 28-day gap. So for adults, the reason for that is it's first of all, what you don't want to do is you don't want, if a patient's got COVID, there is sometimes a risk 2 weeks in, 2 to 4 weeks in, that there is a risk of deterioration. And what you don't want to do is then give someone a vaccine, which people put it down to a side effect of the vaccine, but actually is a deterioration in the COVID. So it's very much to try and keep the vaccine and any possible side effects of the vaccine separate to any COVID and any COVID related illness that's going on. With regards for children, they've left it at 12 weeks. Anyone on the age of 18 for 12 weeks is because obviously one of the side effects or minimal side effects is something called myocarditis, which is a risk, a cardiac thing that can occur with any viruses, actually, whether it's a flu vaccine, COVID, flu or anything else at all. And by having a 12-week gap, they've shown that minimises that in children. So it's 12 weeks for anyone under the age of 18, 28 days for anyone over the age of 18.
Thank you. So yeah, Dee, just obviously bringing in the point, this is what I think the government will need to bring in, some form of exemption for anybody who's tested positive if they can't meet the deadline for the 3rd of February for their first vaccination, or even the 1st of April for their second vaccine. The likelihood is there'll be some form of temporary exemption to allow them to continue to work until they can get that subsequent vaccine once they're 28 days clear. So that's what I would expect. But we'll wait and see for that to come through. And likewise for care homes, I mean, we are expecting again that some stage they will make it so that the full vaccination status, because that's actually what's in the legislation. They talk about being fully vaccinated, and the definition of being fully vaccinated currently is 2 doses, but that isn't likely to change to include the booster at some stage, but we don't know when. But again, there will need to be some form of grace period, because what we are seeing is that booster uptake is relatively low in the care sector for staff. It's great for residents and such like, and for service users, but actually for staff it is relatively low. It may be because some of them aren't eligible at this stage because it's so close to having had their second vaccine. But yeah, it is something it is a concern, and obviously, and many are sort of exercising their right to wait until it does become mandatory. But certainly for being fully vaccinated with 2 doses, they will have to have had that done by the 3rd of February in order to continue to work after the 1st of April, unless obviously they do, catch COVID in that process and it is slightly delaying it. Staff who've only had 1 vaccine will not be able to work unless potentially there is this they do have some form of exemption if you have been delayed in getting your vaccine because of a COVID infection. So you must be fully vaccinated in order to continue to work. It will be a condition of deployment. So in care homes, nobody is allowed to cross the threshold of a care home who isn't doubly vaccinated and who doesn't evidence on the visit that they are doubly vaccinated. So you will therefore, as a condition of the deployment and then continuing to work, will have to have had that second vaccine. The first vaccine, yes, is by the 3rd of February. In order to have that 8-week gap to allow you to be fully vaccinated, or having the 2 vaccines by the 1st of April. But we are still waiting on the confirmation from the Government Department of Health and Social Care of exactly of that time frame, but that is what we're working towards at this moment in time. There might be some slippage with that, but we're not sure. I think they are keen obviously to keep going on that as well. So obviously conversations will need to happen over the next 4 weeks with your staff around those that aren't vaccinated to say, okay, this is the deadline by which you need to have had your first vaccine. And obviously for those who've had the first but need to have the second, then it would be, the 31st of March would be their deadline for having their second vaccine. And if at that stage they don't have that vaccination, then you will legally be able to dismiss them. But obviously what you must do is make sure that you're following the due process around that as well. So we've got some resources that we can help with that as well, as we go through things that ACAS have pulled together that we've used. Now, we did find in care homes, the vast majority of staff, very few left the sector, in all honesty. Ben, have you got the updates on the figures in the end? How many people left the sector because they weren't willing to be vaccinated?
We haven't got a definitive figure, but I can tell you it's less than 50.
Yeah, so out of about 4,500 who work in care homes approximately, there was 50 staff who left. So it was a really low percentage and lower than what we initially feared. And most in the end were supported. There was one care home that I believe had about 19 staff at one stage who were out, hadn't been vaccinated. And in the end, they were all supported to be vaccinated. It was up to the last minute, but they all eventually were supported to be vaccinated through that process. And what I would say, if you've got a high number of staff who aren't willing to be vaccinated, because we know peer pressure and just that general and peer support, equal peer support can help you get all your staff vaccinated if the majority are going through that and you're leading well, and other people within the organisation are happy to advocate for that. But we also know that peer pressure can also send it the other way. If you've got somebody who is particularly against, then other people start to listen to them as well. So if you have those scenarios and you need that support on a sort of more of a one-to-one basis to try and address those concerns, will you please let the COVID team know, and we will do whatever we can to support what those particular concerns are. Rachel, do you want to talk about some of the resources that we've got available from ACAS and such?
Yes, and I was also just going to say people need to also consider about recruitment of staff. And the time frame from, obviously, if you are recruiting staff and they're non-vaccinated, they need to get themselves vaccinated, and then it's a 3-week period, isn't it?
That's what we're expecting. Yeah. So if you're recruiting someone, they've only got to have had that. It's 3 weeks after their first vaccination. And that they
as a condition of their employment, they agree to actually continue the vaccination programme, and so they'd have the second dose. And then if it becomes a requirement that they need to all have boosters as well, that they would actually have the booster vaccination. Unless, of course, something horrendous happened after the first vaccination and they were medically exempt from the second. So both Skills for Care and ACAS have actually got some really good resources to support employers around the kind of HR aspects of this. So thinking about updating policies and procedures, thinking about updating recruitment procedures as well, and checks for your actual service. They've also got ACAS particularly, I've got some really good resources around that kind of supporting people through informing them of the change, then actually having one-to-one conversations, then actually starting to saying, well, this is going to go, to you being dismissed. And it is dismissal it wouldn't be redundancy. So they would not be eligible for redundancy pay or anything like that. It is a mandated condition of employment. So they would really need to seriously think about that if they're going to be dismissed as a result of them not actually having the vaccination. So in terms of ongoing support from government or, benefits, their class has been dismissed. So, that needs to be a consideration. So as I say, ACAS have got some really good resources, and we've put together a little resource sheet for you. Some of the resources listed on that sheet were really aimed at care homes. However, the actual, employment law, etc., it's the same. So I'm sure ACAS, Skills for Care, etc., Public Health will all be updating resources for this sort of second rollout, and they'll be done quite imminently. But we still haven't had the actual formal guidance from the government, although it is perhaps coming today or tomorrow, I believe.
They might be signed off. That doesn't mean to say we'll get the guidance.
No. Yeah, that could be a while. So there's a question there about if staff are dismissed, are they still entitled to work their notice period? So
you would send them or give them notice of dismissal that it would allow for that notice period to say, so effectively, if on the 5th of February, that person has not had their vaccine, then at that stage, you would serve them notice to say, as of the 31st of March, you will no longer be employed by this company, you'll be dismissed. So it would give them an 8-week notice effectively at that stage if they haven't undertaken their first at that stage. And likewise, there'll be something similar for the second vaccine as well. So, but there will be more guidance, and I'm sure there'll be lots of webinars that will come up with a bit more detailed information about this as soon as everybody has the details.
Absolutely, I know there will. I know that organisations like Skills for Care will be quickly on it, as will ACAS. And with ACAS, you can actually ring them for advice. It's a free service. So do make use of them. They are really good. And it may be possible that we actually was he called Rich Jones, came to one of the Registered Manager Network meetings a while ago. But I mean, he may come and be willing to actually do a short presentation for us all, actually to take you step by step through the process, and certainly get in touch with him and see if he'd be happy to do that.
So the next 3 weeks really is all about focusing on trying to support people to get that vaccination. And that's certainly how care homes approached it. It was very much, let's just focus on trying to make sure everybody crosses that threshold and gets over that threshold and focus the conversations on that. Then when we get towards the, up and coming date of the 3rd and the people are unlikely to be getting their vaccinations. And I have to say, in the care home, we had people who did it literally on the last day. There were so many people who did it on the last day. And left it to the last moment. So you might find that with a number of people and potentially with the second vaccine. So just, be aware of that. And then after that, we can then spend your time focusing on how you serve the relevant notice, because most people will be on a maximum of 4 weeks notice. So you've got time within there to send the letters, have the proper discussions and follow due process around that as well. In terms of office staff requiring the vaccination, so obviously we know that in terms of in scope as CQC regulated, anybody who provides CQC regulated services, if they are unlikely or won't be having any face-to-face contact with a person in receipt of services, then technically they don't need to be fully vaccinated. But we know in this sector that quite often, if you're working in the office, there's still times that you might have to go out onto care and different things. If you work in the hospital, even on reception, you're going to come encounter people. The chances of you not encountering a person face-to-face are very slim in many of this industry, but there will be some scenarios where people won't need to be vaccinated. And it should be said that anybody who can be redeployed, you should redeploy if you do have that function to being able to people to go purely work in the office. You would have to look at that redeployment into that role if there is that option available. We know in most instances that's not something that's going to be possible going forward. Just in terms of, just look at some of these other questions, if service users come into office at time, so service, like say, if service users come into the office and such, and things like that, then there's so many reasons. It's very few people who wouldn't, generally speaking, we're talking about if you had a head office only, or something like that, where you would actually be in that scenario going through that. Just to say, the boosters, as we said, are not currently mandated, but we do expect that will change, and the full vaccination status will at some point soon include the booster. We are concerned about the level of take of the booster, and it might be that a number of people aren't eligible at this stage for the booster because of the timeframes from when they had their first and second vaccines. But have you got any feedback as to why staff are refusing to have boosters at this stage? Anybody wanted to sort of come in, join in with that at all? Any feedback? So everything we can do would be great.
We've just had people say that, I've had enough. If it's not mandatory, I'm not having it. Just, I've had enough type of thing.
Yeah, and I think that's certainly what we've seen in care homes, because they have very much been done to and sort of singled out. So, but, obviously it might be slightly different within community.
I'll put my hand up.
Leader.
Yeah, same with here, with ourselves, with the staff saying, well, they're asking us to do a booster now, and how, is this going to be a continuous thing every year? Are we going to have a booster? When is it going to stop?
Yeah, no, and I don't know whether Gavin or Tracy want to come in the likelihood of that, in terms of, I think they're just fatigued with vaccines.
We're join the club, but I'm more fatigued about people not having them than I am about giving them. My concern is that we're running at about 50% of people who've had boosters. So what we're saying is that this cohort is actually lower than the sort of the national, and even the level we're seeing in Bradford. So we've seen a massive drop off in booster uptake over the last couple of weeks. At the beginning of December, when it was all pushed, we had a massive uptake at that stage, but most of those people have now come through, the ones that were very keen to be boosted. And it was just to understand if there's anything else that we can do, because obviously we're spending a lot of time each day discussing this and understanding what we could actually do. We've got masses of availability of slots, but nobody wants them. So we've got less than 10% of our slots at some of our BCN sites being taken up. Jacobs Wells the same, Airedale's the same. Everywhere is basically awash with vaccines, awash with slots, but we've got nobody attending for them. And so it's just to determine, I appreciate people are fatigued. However, it still offers the best protection against actually becoming seriously unwell with COVID. And it's not just about themselves, it's about protecting others as well. So it's not just about their work, it's about home and what they do and what they're able to do. Because obviously, if you're unvaccinated or if you're not boosted, you are much more likely to get COVID. But we're not saying that if you're vaccinated, you won't get it. What we're saying is that you're less likely to be severely affected.
Yeah,
and it's the best protection against the Omicron variant. So we do definitely know that if you've only had the 2 doses, the protection against Omicron does wane quite considerably, which is probably why we're seeing so many outbreaks in homes currently. And it's so much more contagious as well, or it appears to be. So that is also about encouraging the staff to be vaccinated, really, because most of our residents have been boosted. I think that's fair to say. I think we've got sort of, that is where that sort of skews some of the figures. But we've seen the same cohorts coming through to be boosted. They were the ones that were early vaccinated. And although you're quite right, if you were late and didn't have to be vaccinated, you wouldn't be eligible for a booster. But many more than 50% of our care home staff and people were vaccinated early on, so would definitely be available for boosters, much more than the percentage that you were talking about, which was about 25%.
Yeah, thanks, Tracy. Rachel, did you want to come in?
Yes, I just wanted to ask, is there any way that we can make vaccinations more accessible? Because certainly, for staff who are working shifts, who are working additional shifts, and the actual journey to go get a vaccination, get back to wherever they need to be. Additionally, for some staff, it is a barrier, and it's trying to sort of reduce those barriers.
We can certainly make the information available, but like Tracy said, I don't think there's any way you can't go get a vaccine at this moment in time.
No, I know, but if for some people, maybe if they're not a car driver or whatever, I know a lot of staff are, but if they're not, it's just an additional thing that they have to think about and do. Yeah.
Gavin, did you want to come in there?
Yes, so on that point, I think the key thing is there a particular area where we think that we don't have availability of vaccine? What we did a number of months ago, probably closer to 9 months ago, we actually did go to some of the major companies in the areas and do drop-in clinics. So if there is anything where actually you've got a vast number of people that need to be vaccinated in an area, it may be that we could organise some form of drop-in to help overcome some of these issues. I can't make any cast iron promises, but we're organising pop-ups all the time. There was one over the New Year bank holiday in the kind of the Airedale shopping centre. So if we know that actually we think that if you think you've got an area where that a pop-up will be really, really helpful, that is something we could definitely look into doing. I don't know if Rachel, if you want to come back on that, otherwise I was going to pick up one of the questions in the chat. Rachel, did you?
It was just really a suggestion on my part, because I know it did help, obviously, in terms of the care home, increasing the uptake. But it's just a reflection of what's happening in the sector at the moment and how busy staff are, and they are doing extra shifts, so that the time to actually go and get a vaccination is limited. So it was just really, but I'm not aware that there's any particular areas that are not, are particularly badly serviced by vaccinations.
If you were to let us know, then we've got enough staff at the moment to probably do some pop-ups. So I think that is a thing that, if we've got enough people, I'm not saying to go to do or 2 or 3, because that's just not feasible, but if there's a large number of people that would benefit, then there's definitely enough staff at Jacob's Well, which is where the Airedale, they're popping up every day at Airedale now, Gavin. It's not just a pop-up, it's virtually a common thing. But we could also put them in touch with the nearest one, and it may be that they can even open later, or they can do that. There's very much, we're trying to be as flexible as we can to get as many people through as quickly as possible.
And those pop-up clinics will do first and second vaccinations.
Yes, it's an evergreen offer is what we're calling it.
Of everything. So, that's the thing. So if you've got a number of staff, as we said, that need first, second or booster vaccine, we could look at organising something that has been done for care homes. It could be done for this. So if you have a particularly large number, or equally if we've got, and then we could also open that up to other agencies in that area and tell them to come down, etc. So, if that is the case, please let us know. Then we can more than happy to look at how we can facilitate that. Gavin, I'll just bring you, Karen, shall I bring you in first, and then Gavin, I'll come back to you because I know you want to answer another point in the chat.
It was just the idea of the flu bus that we had before, the vaccination bus, and I just wonder, because we're talking about the booster, but I think there's very little take up on the flu jab as well. Yeah. And I think people are sort of feel vaccinated out, but I just think picking up on the point of what Rachel's trying to get across really around the shift work, picking the kids up, because they're usually carers themselves as well. And just sort of, perhaps being a little bit more mobile might be helpful.
Yeah, definitely. Just to say, from our point of view, when we've ever done flu vaccine, we've organised clinics at the office, and that way we've managed to get all our staff vaccinated with the flu jab. And likewise, that's why we organised all their vaccines at Jacob's Well, and they were all facilitated to be taken down there, so they didn't have to worry. The shifts worked around them, etc. And you've got the money within the infection control fund to pay for that, to pay for transport, and to pay for their time to do all of that as well. So, please utilise that. Gavin, shall I bring you in?
Sorry, I was struggling to find the mute button. Mainly used MS Teams, so it's a different location. Yeah, I just wanted to pick up. There was a conversation chat regarding immunity and vaccinations and people, and it's been mentioned having too many vaccines. So I think one of the things just to pick up that is different diseases require different vaccination programs. So if you look at tetanus is not just a one-off vaccine, that is something that you then repeat. Hepatitis B is the same. If you then look at flu is also an annual vaccine because that's adjusted based on the circulating influenza that's going around. So yes, there is a perception that maybe 2 or 3 vaccines for one condition is high, but actually that's no different to a number of others. And it's about optimizing the immunity within the body to maximize that. So this isn't a one-off with COVID. There are other vaccine schedules out there which is more than a one-off. I just want to pick that up, but it's around building up and boosting the immunity. What does it look like moving forward? We don't know that. The clinical trials are ongoing. They're looking at that and what works the best, whether that's once you've had one booster, is that it, or will there be future boosters? We don't know. Once we know any further information, we'll be sharing that. But I get that people are saying, oh, it's all we hear in the news is people are vaccinated out, but actually it is the course of this vaccine is 2 primary doses. Some people even need a third and then also a booster, but that's about optimizing the immunity because your body will lose immunity over time, and that's the same to anything. So it's about building that up.
Thanks, Gavin. Ian, just another thing in the chat. Obviously, it was something about office staff in care homes. Yes, they do need to be vaccinated because the chances of a care home having a completely separate office to the residents within the care home are slim. So there is every chance you will come into contact with those residents. Therefore, essentially, everybody who crosses the threshold of a care home has to be vaccinated, including visiting professionals. Now, that is something, as I've said, we're waiting to find out whether that will apply to the likes of supported living and extra care settings. We are not sure yet until we see the guidance. Ben, I don't know if this stage you want to bring up the flow chart of what this was, a screen grab, wasn't it, from one of the webinars. So this isn't necessarily official, but it's just to give you some idea of who may or may not be in scope.
Yeah, of course. So as Louise mentioned, this was a screen grab by my colleague during the local authority stakeholder engagement. So I just want to double check. Can you see the flow chart?
Yes, we can.
Perfect. Yeah, so the general principle of who's in scope, I know you can see it on the screen, but I'll just quickly go through it. So has a non-exempt individual been employed or engaged to provide a CQC regulated activity? If yes, has the individual been employed or engaged by a person for the provision of this activity? Again, if yes, it would this activity be direct and face-to-face? And again, yes, then that person would need to be vaccinated. Obviously, under any point of that, if you're saying no, then chances are the person won't be in scope. So go back to the first point. So if no, might the individual ever be required to provide CQC regulated activity even while it's not part of their day-to-day role? Again, that would include the conversations around office staff that were primarily in the office, but may potentially, if you were short-staffed, need to go out. So if they would never need to go and provide any CQC regulated activity, wouldn't ever expect to leave the office and go and support someone, then they wouldn't be in scope. But if they would, again, if you were short-staffed, or I suppose the thing is have they received care certificate training, for example, then the chances are that they would be under scope because they will have had that training for a reason. But it's just a very short and simple, sort of flow chart, and hopefully it'll be something that is finalised, or if not, we'll create a local version. So it's very readily available for you to see, and this will be included in the document. And I suppose the other thing on here is what are regulated activities, or what that could be applied to. So personal care, nursing care, treatment of disease, disorder and injury, and also transport services as well are included in that. Thank you.
Louise,
Yes, Gavin.
Just coming back on that, I appreciate that is a screen grab, but that matches virtually word for word the national guidance that have been shared across the NHS. So there is a NHS document which has got that on there.
Right, so fingers crossed it won't look too dissimilar when we do get the guidance at some stage. as well. And just to say around, you know, people where you may have clients and service users within the community who aren't vaccinated and are choosing not to be vaccinated, yet your staff are forced. Yeah, I completely agree. It might be frustrating, but actually it is about that duty of care. It is about protecting that individual. And if they aren't willing or able to protect themselves, and actually this is something that you can do to protect them and to support them, and, you know, and make sure that they don't pass on or less likely to pass on any COVID infection to them, which if they're not vaccinated could be potentially very dangerous. So it is about that duty of care and how we can support. Now, again, another question around about whether PAs are to be included, and our understanding, Ben, is that they are, aren't they, I think? Is that right, Ben?
It's a little bit muddied, unfortunately. From the stakeholder engagement, the answer was yes. But when I went back, because again, one of the big things is how we're going to monitor this, how are we going to ensure that people are being vaccinated, because there is no way of monitoring this really. The answer from the Department of Health and Social Care was that they're probably not going to be included. So I've got one answer saying yes and one answer saying no. So my position is we're waiting for the final guidance. It's on our radar, and I'll make sure to update people as soon as possible. So I've already notified the direct payment team that it's something that could be potentially included. And I know it's the questions come from Sam, so I'll make sure to keep you updated as well.
Right. Thanks, Ben. The other thing is just to say, if we find out again that in certain settings like extra care and supported living, it will be similar to that of a care home where you'll have to evidence that visiting professionals are vaccinated. There is an app that was developed by a care association called Verify Plus that care homes are using. And that enables you to store a record of who comes to the premises, who has been vaccinated. So once they've presented that evidence to you via their NHS COVID pass that they are vaccinated, you're able to store that securely without meeting all sort of GDPR regulations, to say that yes, this person, I've seen their vaccine pass, and I now know that I don't have to ask them on their next visit. It just recalls that information. It's all held in a cloud, it's all safe, and that is currently being looked at how that can be adapted if it's needed for other settings. So that the likes of extra care, supported living, and potentially even things like GP practice and things, if they're going to be in scope. So that is being looked at this moment in time, and we'll be ready, and we'll make sure that people are aware of that if that does become that it is in scope, and we'll let you know. We're using another commenting around Verify Plus. It is really simple and easy and making our life a lot easier, and we're adding more and more to that all the time to make it better and more functional as well. Just to say around the agency situation, and I don't know how many people, I suppose in certain settings you will use agency staff. So the agency staff is a bit of a loophole at this moment in time, because ultimately they're providing regulated services. However, the agencies themselves aren't regulated. So the Department of Health and Social Care government actually don't have a sight of how many agencies are out there, who those agencies are, how many staff they have on their books, etc. And what we have seen is certainly a move from care homes people, and then even obviously within the NHS, people who weren't willing to be vaccinated to potentially towards working in agencies. And a lot of those where they couldn't be deployed into care homes have more than likely been deployed into other settings that it was permissible to go across to without being vaccinated. So what you will also have to check is that any agency staff that you're using are also fully vaccinated. It is going to be a bit tricky to get around to full sight of this information, and for the Department of Health and Social Care to regulate it and check that. So it is something that will be on your onus to actually do that and to double check that they are vaccinated. But we know that their uptake was relatively low a few months ago compared to what sort of care homes, etc. I think it was about 40% of their staff were vaccinated at one stage, what they were indicating at the time when VCOD came into care homes. So it's just to be aware that if you do use agency staff, you must check that as well. So if you're a non-regulated service, we don't perform regulated activity. So if you're non-regulated and it's not regulated activity, then it actually won't be applicable. You'll be out of scope for that. according to the diagram as it stands at this moment in time, but we're still awaiting that full guidance. I mean, obviously it is advisable for any setting that comes into contact with vulnerable adults or children that everybody is fully vaccinated to support and protect, you know, part of that duty of care and to protect the people that you're supporting in that setting. So although it may not be mandated, it's certainly advisory going forward, but we'll get more information on that going forward as well. Are there any other questions for anybody? I think we've answered most of the questions that were in the chat. I know there's still a few more questions and answers at this moment in time. Anything from anyone? Please feel free to put in the chat or ask. In extra care visiting for us, can someone who lives there without care team's knowledge be buzzed in? Well, this is, I think, the difficulty. So yes, so in extra care settings, obviously you have the actual the property owner, if you like, or people who are in charge of the actual the property themselves, and then you have the care company who are in there. And separately to that, we don't know because an individual with their own accommodation in there, with their own property, could arrange for a plumber, for instance, to come and sort something out. Actually, will they then need to be checked at the door by whom, etc. So this is where we don't know whether this is going to come into scope or isn't. What I can say is that in certain extra care settings where they are adjoined to a care home, they've had to take this approach for all, because they are adjoined to a care home and there's no sort of differentiation between the two physical as such. So it's then they've had to go with that they're operating under the regulations as if they are a care home. So it will be depending on the setting, and obviously sheltered accommodation will be slightly different to a true extra care setting and such. So we'll have to work through the different nuances of this once we get the guidance around that. But yes, it could be a challenge when we do get to that stage, because we are waiting to find out on that. Any other questions? Is there anything else that we could do that would be helpful? You know, obviously, like I said, well, there's so much information on the provider zone available to people. There is the resource pack that's just been produced. It'll be updated on a regular basis with all the latest guidance and templates, etc. We will send out as soon as any webinars are organised around sort of the HR side of things, because other organisations, well, Skills to Care quite often organise different things like that. So we'll make sure we send those out and get those out to people. Gavin, did you want to come in?
Yeah, just picking up a question in the chat which said about booking boosters at Jacobswell, Airedale, or any of the vaccination sites. There's a link there that Ben's put in the chat. Alternatively, just Google COVID vaccinations and you'll be able to go through to the NHS website that books it in. That's probably the best thing to do, as opposed to calling 119, because they'll just refer you directly to that website anyway. As is put in there are walk-in centres that are around if people just do want to pop in, and that information is available on that web page that Ben's put in the chat. But if you want to book an appointment, just Google COVID vaccinations, you'll go through to what's called the National Booking Service.
Yeah, and if you have any difficulty, or as we said, if there are a large number of staff that you would like support with, for whatever reason, you know, if there's a particular hesitancy that a number of your staff are sort of discussing, please let us know, and we will look to either get you tailored resources that can come out to you. We'll look at a pop-up if appropriate, and we'll, you know, we can invite other providers to attend that as well. Ben, did you want to come in?
Yeah, I just, as always, just want to offer the COVID-19 support teams help in anything. So when the guidance does finally come out and you're reading through it and you've got a couple of questions, or if there's something that's a little bit of a grey area or anything like that, please email the team and we'll put our heads together in order to get a response out, or at least we will ask the people that need to give the steer for the district in order to get a response back to you about what we'll be doing in Bradford. So if there are any questions once the guidance comes out, please feel free to email us and we'll do our best to provide an answer.
Brilliant. Thanks, Ben. Tracy.
Just to say that not all the PCN sites will be on those bookings as well. So some of your local GPs will be offering those as well. So if you hear about them, most of them would be happy to vaccinate, people are not registered there as well. So it's just that most of them are not on the sites. There's only a couple of them that are actually on the walk-in sites and availability. But if you have any particular problems and we know there's a GP surgery near that's offering clinics, then we could also do that as well. That might be a link. You know, it may be that there's a surgery nearer that might be easier for people to access.
Brilliant. Thanks, Tracy. Rachel?
It was just really to remind people, like my managers, that the WhatsApp group, if you're not on it, it's a really excellent support network. You know, the manager will ask a question and usually you'll get 3 or 4, often more responses. People have either experienced it, they've got a good idea, or they've got a clear understanding of something that isn't made, you know, is like as clear as mud to you at the moment because you've read 3,000 documents that day. So the WhatsApp group is really, really good. And Meg manages it, doesn't she, Louise, from the BCA? So you can just, you know, email admin at the Bradford Care Association, and Meg will add you. Your manager or deputy, you know, please feel free. It's a fantastic support network.
Yeah, definitely. You know, any questions, anything that happens, you know, struggling to get hold of lateral flow test, whatever it might be, it's there as an option. So please make sure that you utilise that, because it is really, really helpful. And just remind, it is never too late for anybody to get any vaccination at this stage. You know, flu, whether it's COVID, the two can be given at the same time. They can be given a day apart, a week apart. It doesn't really matter. It is there, available through a variety of channels. If you can't access it or you're struggling, please just let us know. But it's never too late. And if you have any staff who right at the last minute or have buried their head in the sand, and we did see this, and you know, on the, I don't know, the 10th of February suddenly decide, actually I now don't want to lose my job, you know, then they won't be able to work for that period from the 1st of April till the point when they can have their second vaccine. But, you know, maybe they can look at annual leave, unpaid leave and different things like that, or, you know, looking at catching up on their training at that point in time for that week, etc., while they can't work. So, you know, there's some of the other things that people did to support people who weren't able to get quite through the vaccination in time. But as I say, I suspect there will be some kind of temporary exemption for those that have a delay because of, you know, caught COVID over these last few weeks, and then unable to get their vaccine as planned, or as they would have intended to do so. But we'll have to wait and find out a bit more information on that. We'll still, again, wait and find out about the new recruits, full details about how you recruit new people, and that after their first vaccination they'll be able to work after 3 weeks. So, you know, as soon as they have a successful interview, at the same time as sending off their DBS, send them for a vaccine if they're not already vaccinated. And probably by the time the DBS, etc., comes through when they've completed their training, they'll be ready to start in work. And that will apply to care homes as well. We hope that will apply to care homes as soon as the legislation comes in, rather than having to wait till the 1st of April. But again, we're just waiting for more information on that as to whether that will be the case or not. And a reminder about your infection control fund, that is there to support you in managing these vaccines, in trying to support staff to get these vaccines, in transportation, their time in order to get the vaccine, and all those different things as well. That is there to support you in doing that. So please utilise that fund there. There is also the workforce grant as well, don't forget, about recruiting and retaining. And given that actually a condition of recruitment and retaining staff will be that they have to be vaccinated, then it could also be deemed as a thank you for actually taking the time and taking that leap to get vaccinated, you know, that you are giving a retention bonus to those staff who have been stayed with you, worked with you through what has been a really challenging time, particularly over the last few weeks and months, and over the next few weeks and months. But also, as it can be indicated as a thank you for taking your vaccine at the same time as well, because it will be a condition of retaining their job in the first instance, or recruiting. So have a look at how you utilise that and how you word that to staff. Because again, it could be another asset to say, you know, as a thank you for doing this and getting your vaccine and being fully vaccinated and staying with us over the last 3 months. there's the workforce grant that's being paid to you, which the initial amount for the first part I think was £145 for the first element, and the second element is £300. And obviously they could be used to be paid as bonuses or etc. As well. So have a look at that and see how you can utilise that. Are there any other questions for anyone at all? No. Just as a reminder as well, while we've got you, it's just around. I hope everybody received the email about the SUS and that the service update system, or system service update, whichever way around it goes, that has been reinstated for you to flag whether you're red, amber, or green if you're having any challenges around staffing, accessing lateral flow tests, PCR tests, whatever that might be. We are aware, obviously, that home care providers are unable to order lateral flow tests like care homes are, and therefore you're having to go through the same route as the public in order to access those. So we're in the process of trying to arrange a central stock of those so that when home care providers aren't able to get them, to enable your staff to continue to work, then you'll be able to pick them up from a central store. So we are working on that at present, because we know that people are going through lateral flow tests at a rate of knots, and likewise with PCR. So please just let us know. Make sure you're using the SUS and updating and flagging. That will be monitored out of hours as well, and over weekends. And don't forget the IPC team, Darren and Michael are there to support as well with anything, and the WhatsApp group. Ben, did you want to come in then?
Yeah, I was just going to say we do actually have a central stock now through the COVID hub. It'll be managed through the COVID-19 support team. So if you get in contact with us, we'll be able to support. Unfortunately, because they need to supply a large amount of people with the lateral flow, we might not be able to meet your specific orders, but we'll at least manage to get enough for your staff to be tested. I just want to put that caveat on there, because we have been told that some providers have been ordering a large amount, but we can't do that up front. So you'd have to probably collect it and then again collect it again in the next week or the next 2 weeks, for example. We won't be able to front you for a month like you could on the national portal.
Yeah, no, and just say, so there is a sort of a process of rationalisation and prioritisation for lateral flow tests at this moment in time because of the challenge in accessing them. And obviously we know that PCR tests are a bit of a challenge to get hold of as well at times. So at the moment you can still access those through the national booking system, which it can be a bit of a challenge at times. But if you do keep going, it does refresh. Centenary Square do offer walk-ins as well, where you don't actually need to have an appointment, so you can just walk in there, but can't guarantee necessary availability. And we are also looking at some provision at both BRI and Airedale for any critical staff. Again, that'll be managed through the COVID team. So we've got availability there for needing that rapid sort of access to PCR and test results as well. So please let us know on that. Is there anything from anybody else at all? Doesn't have to be vaccine related. If there are any other queries while we're on, I'm sure it'll all be COVID related, whatever we do. No. Brilliant. So yeah, Centenaries, they are bookings, but you can actually there is the option to just walk in as well. They do have walk-in facilities available, but you can't guarantee, if you go down there is a chance there could be out that, but they do have walk-in clinics. We are trying to secure a bit of a priority access for care workers and health and care workers at the moment at Centenary Square, but that hasn't been done as yet. But you can, there is the option for walk-in at Centenary Square for that, and that's for PCR, that's for PCRs. But obviously, just in terms of vaccinations, there are a number of walk-in clinics for those all over, which are listed on that page as well. Anything else from anyone? No. Right, well, thank you very much. I hope you've all found this useful. We can organise another if we need to. Reminder, we've got provider update next Tuesday at 10:30 on the same link. We'll put a reminder in the WhatsApp group, so we'll just update you on all things where we're at and where you can access different things and guidance, etc. So please attend that. It's for the whole sector. Appreciate sometimes care homes can dominate with the challenges that they have, but it is for the whole sector. So please, feel free to join and attend that. And if you've got any questions, the COVID team are there. We're here. Use the WhatsApp group. And yeah, please get in touch, and we will share this recording and all the resources through the bulletin and such at the end. So thank you for everybody for attending, and we'll speak to you all soon.